I think one of the questions that will come up a lot is around data protection and privacy rules. That's always a very sensitive area with healthcare, dealing with patient data, and perhaps also the boundaries between when you need to think about the medical regulatory rules as well.
I think hints and tips for the startups that are here today. Open up as many different and interesting conversations as you can. Try and reach out to the people that you wouldn't normally reach out to, because we've created quite a unique opportunity here, which is bringing a lot of different people with a lot of different perspectives on board. Networking is a contact sport, so you've got to be in it to win it.
If you're in the digital world, when you're looking at the Technology Strategy Board grants, think about healthcare. If you're in the healthcare world, think about advanced materials. Look across our offerings and our competitions, whether it's SMART that's open all the time, whether it's our collaborative research and development competitions that are challenge-led and have a specific timing and scope. Try to be creative and apply, because it's not just a simple box.
We're just finding that people know what they know, but they're also starting to realise there's things they don't know. And so it's making the connections to the knowledge and to the other people that are working in this space. So I'm here to do a plug. Please, as a result of this meeting, join our new group, which is the Digital Health Special Interest Group through the Health KTN, working in collaboration with others. This is something where we're working very closely with IC tomorrow, but we are trying to build a community in this digital health space so we can all get to know each other, communicate more effectively, and really look at matching the need that we have out there in the healthcare sector to the solutions that you can provide. So very keen to do that. Please join us, and we'll do more of this together.
One of the really key topics which has come up time and time again today has been intellectual property. How do you protect it? How do you exploit it? And so clearly that's a real concern for a lot of people in the room, and rightly so, because there are some great ideas. I think another one which is really particular to this sector is data protection and privacy. How do you manage to provide a brilliant new technology whilst also complying with the rules? Very interesting discussions, and thank you very much for coming to see us today.
Two issues came up. One was, how do we get into the NHS? How do we penetrate the NHS and get beyond pilots? And my tip is, from day one, involve clinicians and the people that you're going to be working with. And the second aspect was business models. How are you going to make money from the products that you're developing? And again, from day one, think about the business model that's behind the service or product that you're developing.
The biggest question that I had was, where can I access data, good data? And this ranged from genetic data to activity data. So people really want to help signpost to people that actually hold data and how they can access it. Other issues are privacy issues, as you may expect with medical data. And also, when they've found people that hold the data, they would like to have a more constructive relationship with them. They don't want to hit a paywall straight away. They want to develop it, build a business model with the data holder, and then suddenly they can actually have sort of a more commercial activities from that.
From a very low base, admittedly, there's never been a better time to raise basic risk capital than now in Britain. So lucky you, you're in the right place, in the right time. So well done. The second thing I will tell you is that you've got to understand what stage you are at and whether you are ready for investment. There are investors out there. If you do think you are ready for investors, let us know. Come and see myself, Capital Enterprise. We'll look at where you are and match you to the suitable investor.
So what we figured out is that we have a major problem. People think they want to collaborate and then go into a room with a potential collaborator and don't know what to propose. My advice for them would be know exactly before you enter the room what you propose and what you want to get out of it. The other thing is people think they're looking for example, a good branding. Some people think that by proposing to the collaborator, they're looking for a good branding, that's a good strategy. It's actually not. You need to know what the collaborator is hungry for.